we saw a car wreck because he slid on the ice, and it was crazy.
Yeah. I live way out on the west end, and there's a couple intersections that were pretty bad.
Yeah, like the sidewalk was fine, like trying to remember like crossing the roads and like the actual road was terrifying. Carson fell, he slid.
He's in this building a lot.
Yeah.
Seen him several times.
I'll say he's only taken like 2 classes a semester, I think. 2 or 3 years old.
He's great.
This will be he's done after this semester.
He's having a good seat. He's been healthy.
Yeah.
Doing really well. Do you ever get? I've seen people wear things on their shoes that are kind of like dig into the ice.
Yeah. I've never worn them, but I know people that do. I guess if you did like more like trail running, maybe just over here.
Yeah.
It might be a little bit more beneficial than on the sidewalk, I feel like.
Yeah, that'd be a little too much grab.
Yeah. I feel like it'd be hard on your feet too, if the middle starts for that long.
I've seen, is it Dave Kopic? He has those.
Oh, I'm sure Dave does, yeah.
Well, Megan, how are you? Okay. Are you from around Billings, Montana, or?
Park City, so it's like
Okay.
30-ish minutes.
Not too bad. Do you commute, or?
No, I live in Billings.
Oh, that's more convenient. Couple more minutes. You're playing well on Saturday.
Thank you.
Well, would you rather have the door closed or open, or no preference? Well, we can keep it open. So close enough. How's everybody? All right. Seen almost all of you earlier today. So I'm feeling better, almost back to 100%. Allowed to come and teach starting yesterday, so be back, getting a little better every day. So, do you have any questions about the course outline? There's lots of parts to this class, and if we complete those parts in a sequence, a little bit at a time, we're not rushing to do the whole thing right at the end of the semester, things work out really well. So what I'm hoping with this class is that you're able to get a springboard into your thesis. My suggestion would be the project that you do for this class would be kind of a mini version of your thesis. So all of you probably next year will be doing your thesis. And so this would be a great way to do a small pilot study on it. And then you'll have a great idea of what to do for next fall or the following spring when you do your thesis. So with the thesis, there is a little more extensive work involved. There's a lot of polish that goes into it. Whereas the project for this class is just kind of a pilot observational experience, getting your feet wet in the research process, and then you really go for it with a full-on project. So With your project for this class, there's no IRB approval required. You'll involve anywhere from 2 to 5 people just doing your procedures. We'll talk about what your procedures could be. I would suggest going with something more cross-sectional than longitudinal. We'll talk about what that means. Keep it simple. Don't try to solve all the problems in HHP with a single study. Just have the end goal in mind, which is getting through this class and then moving on to your thesis. So for today, we will go with chapter 1. I know it says we should be on chapter 2 by now, but there's enough flexibility in the schedule that things will shake out. If we do need to change the date of an exam or something, I'll let you know well ahead of time. Quality is more important than making sure we cover the entire book. So, and I want you to research something that you enjoy. So I don't want it to be a burden to do the project for this class. Also note that on Thursday, we'll have a guest speaker, Janae Cross from the Office of Research and Compliance. This is important because she will talk about getting IRB approval. So after this class, when you move on to your thesis, you'll need to submit an application to the IRB. You'll need to make an informed consent. And so she'll be here to answer those questions. So really a great opportunity. She's the one that actually provides the final sign-off on your thesis procedures. So a good person to get to know. So when you submit your IRB application, you'll go back and forth a couple of times. You think you have the perfect application submitted, but there's always suggestions or revisions. And so she'll send it back once or twice, and then she'll give you approval, and then you can proceed with your data collection. So that's your thesis. For this class, no IRB approval, but this is a good preview of what you'll have to do. And then coming up on research proposal topic is due on February the 1st. So that's a week from today. Maybe some of you have a research idea already. Anybody by the show of hands thought of a title, or Sydney?
You want me to share it?
Just briefly. What's your idea?
I want to use EMG to assess activity in lower extremity muscles and
Okay.
different ankle PT exercises.
Okay, great. We have a very nice EMG system, and wireless, works great. So, okay, great. Is that something that you've had experience with already?
Oh
or?
yeah, I have lots of PT experience for it.
Okay. And sometimes that's what promotes ideas for research, is personal experiences that you've had maybe with rehab in some way. Anybody else thinking any other ideas? So, okay. So just know that take the week, and then I'm going to expect something from you in a week about an idea. And then things, we have another guest speaker, Tyree Jinks. This class period in particular will meet at the library, room 311, and she'll go over how to do research searches. All the wonderful resources we have over at the library, she's going to talk about that. So it's really nice to have your topic by then, because then when we go over and she asks, well, is there any questions, you can raise your hand and say, well, what if you were searching for this? And she could help you with that. Today we'll go over in class some of the stuff that the library offers that is specific to health and human performance. So, okay. So any other questions as you look over? All right, so I always post the PowerPoint on D2L. close to class time, I may see some things in the PowerPoint that I want a little bit different, so sometimes I'll repost it. Don't be surprised if you see maybe some slight changes in the PowerPoint as we go from class to class. It's just to improve the delivery of information. Okay, Chapter 1, Introduction to Research in Physical Activity. So what does the word research mean to you? Lots of work, frustration, late nights. It's easier than it used to be. This is one of those stories that you hear maybe from your parents or but it's true. So I used to go to the library on Saturdays when I was a student, and I used to go with pockets full of dimes. And I would go, and you'd have to track down the article in the, what they call the stacks. So all the issues of journals are bound together, and then you track that down somewhere like on the, I don't know, the 5th floor of the library. Nobody around, and you're looking for this one article that you need. And then you'd have to go to the nearest copy machine to make a copy of it. So whereas today, everything is available online. So it makes it nice. So Tyree will talk a lot about how to access those things. So what does research mean to you? Testing things, okay, Jordan. Different conditions. Okay, looking at how characteristics change over time based on a treatment. Maybe you've also heard of a control group. What is a control group in a study? So you have the group that gets the treatment, and then you have the other group that's called the control. So the control doesn't get the treatment. Why would you want to have a control group? Yeah, so you can see if there's any true effects or real effects from the treatment. So if the control represents reality, and then you apply a treatment to another group, you want to see if there's significant differences over time. How many of you have heard that word significant in the context of research? So the word significance is something we use a lot. Statistical significance is a word that we use a lot. Whether something is statistically significant is important, but shouldn't be what we strive for with research. Sometimes you go all the way through your research project and you do your statistical test, and the difference between groups or conditions was not significant. And that's kind of depressing to think about. But we go over a lot of other measures, such as effect size, that you can see something that's maybe not statistically significant can be practically significant. So as an athlete, you do this intervention, and maybe you know that if you do this intervention, the average improvement in vertical jump is, say, 1.5 inches. So maybe 1.5 inches on your vertical isn't statistically significant, but is it practically significant? Is it meaningful? I think most athletes, if they knew they could put in a little bit of effort into this intervention, if they knew they were going to get 1.5 inches out of it, they'd probably do it. So just because something isn't statistically significant doesn't mean it's meaningless from a practical standpoint. So we have to keep things in perspective, and you have to form your own opinions. So we compare things. We formulate hypotheses, an educated guess, what we think is going to happen. How do we form our hypotheses? How do we make an educated guess? What would be some things you would do going into your project to hypothesize about what might happen, what would you do? Could you look at maybe previous studies, what's already been done, similar interventions to what your project is? As you start thinking about your research idea, look into the literature, and chances are you'll find something that is very similar. So then you read through the abstract. How many know what an abstract is? So any scientific study, original investigation will have a summary right on the first page that goes all the way through, and then usually the last couple lines of the abstract give you the take-home message. So abstracts are a beautiful thing because you don't have to read through the entire study to get the message. You just go to the end of the abstract, okay, this is what happened, and then maybe you can keep that one in one file that says studies that are consistent with my hypothesis, and then maybe you find another study that is not consistent with your hypothesis, so you put that in another folder. So can you see how you're starting to build a lit review? You start to categorize studies based on where they fit in the context of your idea. Do studies always come to the same conclusion? What are some factors that would make two different studies that use the same population have different results? So you take two groups of people and you do the exact same intervention, and in one case the group responds a certain way, maybe consistent with your hypothesis, and in another circumstance responds opposite to your hypothesis. So that's possible too. Chances are you'll find studies that are on both sides, consistent with your hypothesis as well as different. So you have to look collectively at the body of literature and figure out why maybe some people respond differently than others to an experimental intervention. So basically you have your experimental group and your control group. Okay, so what are some characteristics that we look at in health and human performance? So Sydney's going to be looking at muscle activity. Okay, so that's an outcome of performance of different rehab exercises. So Sydney's study would be considered cross-sectional. So at a moment in time, she's looking at a group of people and how their ankle muscles are activated by a given exercise. That's cross-sectional. Another example, so if we took all of the ladies on the basketball team and measured their vertical jump. And so you come up with a list of scores, and then you can take the mean and the standard deviation, and then you can go over to the track team and you can do an assessment of vertical jump, and you come up with the mean and the standard deviation. So you can compare vertical jump between different groups of athletes, track athletes, basketball athletes, softball athletes. That would be an example of a cross-sectional design. Longitudinal designs follow outcomes over a long period of time. So changes in a certain variable over time. So if we were to take a group of athletes and apply a certain intervention, and then we followed this group over time. So we assessed vertical jump after 4 weeks, and again after 8 weeks, and again after 12 weeks. We're tracking that variable over time to see how that variable, vertical jump height, changes in response to an intervention. Which type of research is easier to do? By far, cross-sectional is easier. Not saying we shouldn't do longitudinal research. Longitudinal research is probably greater value, but it's a lot more time intensive because you're tracking people over a long period of time. So you're asking people to participate in this intervention over a long period of time. So the longer you're tracking someone, the more difficult it is to have all the procedures followed in your protocol. Okay. All right, so research is systematic. So we look at variables. Is any characteristic that can change over time? So lots of them in health and human performance, strength, jump height, power output, bat swing velocity. Had a student last semester that looked at the effect of medicine ball throws on bat swing velocity. Found a pretty good effect. How many know Dominic Busso? Yeah, he actually did an interesting one. He combined whole body vibration with medicine ball tosses. And so that was his intervention. His control was without any vibration or med ball tosses on bat swing speed. So that's an example of a cross-sectional type study. So the independent variable is the treatment variable or the experimental variable. So this is the variable that's believed to affect the outcome, or the dependent variable. So for Sydney, her independent variable would be, are you looking at 1, 2, or how many exercises potentially?
3.
Okay, so ankle exercises would be her experimental variable. And within that experimental variable, she has 3 different conditions. So you can have 1 or more conditions underneath an experimental variable. So ankle exercises for Sydney would have 3 different conditions, and then the outcome would be the activity of whatever muscle she chooses to measure. Have you decided on muscles?
I haven't figured it out yet.
With EMG, it's tricky because the best ones that you can pick up with that are close to the surface. So just underneath the skin. So really deep muscles. Soleus is a little tricky because you have the gastrocnemius over the top. So important to look at previous studies. Okay, then what are confounding variables? These are variables that can interfere with the experimental variable. So other factors. And as humans, we have lots of confounding variables in our lives. And you'll find out as a researcher, there's lots of confounding variables that can have an effect on the dependent variable. So some examples of confounding variables. Time of day. Time of day can affect how an individual performs. Quality of sleep. So say during the first test, the individual is well rested, it's in the morning, they have very little psychological stress in their lives. Chances are they're going to perform pretty well. So they go all the way through the intervention, and then at the post-test, which can be towards the end of the semester, maybe their sleep quality isn't as good. Maybe they have a lot of psychological stress. So those things can confound the effect of your intervention. So these are outside factors. So what are some ways we can control or minimize the effect of confounding variables? So you're getting ready to do a post-test, and the night before the post-test, what are you going to do? You're going to send them a text message that says what? Exactly. So as a researcher, you want to try to create as much control over these confounding variables as possible so that you're getting the true effect of the intervention and your results aren't due to just a lack of sleep or being stressed out, having a bad day, and so on. Because humans aren't machines. And that, at any time you're testing humans, you've got a lot of things that are entering into this study that could be considered confounding variables. You want to make things as consistent as possible between one testing session and the next. Okay, so problem solving. Why is it important that our procedures be replicable, repeatable?
So then when people try to experiment, have close to similar results.
Yeah, consistency. We're building the body of literature with consistent results. So if somebody over at Montana State, Bozeman, decides to repeat Sydney's experiment, they should come up with similar results. So we want procedures that are repeatable, replicable. So research problems and questions come from many sources. So we can address controversial issues, things that are debated in scientific journals. About 20 years ago, single versus multiple sets was a popular research topic. The popular one recently has been post-activation potentiation. Lots of people like to study that, which is great. So things come and go. Lactic acid versus lactate. Okay, so we went over that in exercise phys. Allie's heard all about that. But that's another debate. We'll talk about that. Testing new theories, striving to improve present practice. That's what I like, striving to improve present practice. So, conducting a study that can be used to benefit people is the best kind of research, in my opinion. So many studies are conducted and then they just sit and collect dust on the shelf in the library and are never read. And so applied research is really the best kind, because maybe over time we can improve treatment. Okay, so I want you to read through this paragraph. Just take your time. is focusing on, this is from your textbook, chapter 1, focusing on the importance of making research useful. So not doing research just for the sake of research, but the overall message and the meaningfulness of it is really important. Something else to consider from chapter 1. So maybe if we improve the readability of research, maybe it can be of more value. The journals in this field, they're excellent at promoting the applied part of research. One of the limitations with sports science in the United States is most studies that are longitudinal will last for the length of a semester, because a lot of the sports science in the United States is conducted at colleges and universities. So what happens beyond 16 weeks? That would be useful to know. So we have an abundance of studies in the United States that are 12 to 16 weeks long. And it's difficult to figure out what happens beyond that point. The other thing is that tenure at universities depends on publishing. So people publish, but really don't care about the meaningfulness of their work. It's just another journal article and put it on the shelf. So we want to make research more useful. So in your writing, I want you to work on being simple in the way you say things. Very straightforward. Research literature is famous for using a $3 word when a nickel word would do, so to speak. So this point in time, you could just say now. So make your writing more concise. Initiate is a $3 word. Start is easier to say and think about. Terminate, end. Chemotherapeutic agent. Drug. Okay. So be straightforward in your writing. Make things easy to read. Become familiar with a few publications. So what are some that you're familiar with in this field? Have a lot of them. Hoping Tyree will help introduce you to more. We'll talk about some today. Keep in mind that no single study is proof of anything. We want to see things that are validated repeatedly to get the overall message. So read the abstract first. Easy way to get the overall message. 10 seconds, read the abstract, you know exactly what the study found. Don't be overly concerned with statistical significance. So look for the take-home message. That's where learning to read research is really important. So here's a quote from Thomas Huxley. He said, "Science is simply common sense at its best." So we should make sure our procedures are repeatable. People in different locations can do the same project, get the same result. 1.4 million papers are published every year. Can you believe that? So what's really concerning is how many of the reported findings are incorrect. Occasionally, in a journal, there'll be a retraction where something was found that wasn't consistent or the way the data was analyzed, so the authors will retract it. So chapter 5 is all about the ethics of research, and we'll talk about that. Okay, so now it's time to engage. So what I'd like you to do, go to this slide in the PowerPoint. This is one of the many great journals in HHP. So all you have to do is move your cursor over the journal there and then just click. Okay, so the Journal of Strength and Conditioning Research, January 2022, volume 36, issue 1. All I want you to do for the next 5 or so minutes is I want you to scroll down through this month's issue, look at the titles. If you see something that looks interesting, just for your own benefit, I want you to click on the abstract. Scan through the abstract. Look at the very end of the abstract and see if you can get the take-home message. You have several that are part of this month's issue. So take just a few minutes. I'm not going to ask you any questions, I'm not going to quiz you. I just want you to get familiar with looking at the research. Look at the number 2 here. Bench press at full range of motion produces greater neuromuscular adaptations than partial executions after prolonged resistance training. That's interesting. See if you can find anything else. This is just a activity to practice reading research. Maybe some of these in this month's issue would help you decide on a topic.
You're done with part 1.
PowerPoint loading. Slowly.
Or you can just go into the website.
A lot of studies in here with clinical application here. Patellofemoral pain syndrome. Lots of running, distance running type studies as well with this issue. Anybody know what capsaicin is? That's red pepper. hard to take any of that, wouldn't it? Regardless of whether it improved anything. Vitamin C and E associated with cryotherapy and recovery, in the recovery of inflammatory response after resistance exercise. Okay. All right, so that's an easily accessible journal. Our library owns that journal, and so you can easily get access to any study. You can get a PDF of any study from the Journal of Strength and Conditioning Research. Let's take a few more specific examples here. Read the title to this one with me. Activation of the gluteus maximus during performance of the back squat, split squat, and barbell hip thrust, and relationship with maximal sprinting. Does this study have practical application? A huge amount of practical application. How many of you have ever asked something close to this question before? Yeah. So let's take a look here. Right at the very end, peak sprint velocity correlated with both anterior-posterior horizontal force and peak ground reaction force during the barbell hip thrust. And you can see the correlation here is 0.69. How many know what a correlation is? A correlation. Another word for it would be an association or a relationship. So a positive correlation means that as one variable like force goes up, the other variable improves in conjunction with that. So what this is saying is that the more force your feet produce through the ground during a hip thrust means what for sprint performance? Means better, means faster sprint performance. So peak sprint velocity correlated with the amount of force your feet produce, and so they were using a force plate. So they had these people do hip thrusts with the feet on a force plate. Can you imagine doing that? We have a force plate. You put your feet on, you could do a hip thrust that way. And then these different force vectors were measured during that, and they found that people were faster when they could produce more force during the hip thrust. So going on the increased activation of the gluteus maximus during the barbell hip thrust and the relationship with maximal running speed suggests that this movement may be optimal for training this muscle group in comparison to the back squat and split squat. Isn't that interesting? So if you want to run faster, you ought to be doing what? You know, do some hip thrusts. Okay, it's kind of the overall message. So that's a good study. That's something that you can use. This is the kind of stuff that I like, stuff that's applied. Okay, what about this one? Higher peak fat oxidation during rowing versus cycling in active men and women. So how many of you have ever had maybe a roommate in a different major ask, how can I burn the most fat? Or maybe another person outside the field asks you, what should I do if I want to burn more fat? Okay, well this helps answer that question. So you read the title, then you go down to the very last part of the abstract and you say, prolonged rowing having equivalent calorie expenditure. Okay, so they're burning the same number of calories, but the question is what portion of those calories are coming from body fat. And so what this says, so equivalent caloric expenditure and intensity. So they're working out same intensity, burning the same calories, versus cycling elicits higher peak fat oxidation. What does oxidation mean? It means to burn it up. That's what our bodies do, is they burn fat in the presence of oxygen. which is likely attributed to greater muscle mass used during rowing. So another study, very practical type of message. Okay, another one. Does intra-abdominal pressure have a causal effect on muscle strength of the hip and knee joints? You might look at that and think, well, how does that, you might pass that one up, but what is intra-abdominal pressure? How do we get more fluid pressure in our abdominal cavity? What's something that you should do anytime you're doing a ground-based lift? Say it louder.
Brace.
Brace. I give you a high five, but I don't want to make you say it. Brace. What does that mean to brace?
Engage it more.
Yes. That's how we increase intra-abdominal pressure. And it turns out, if you go to the very end, the intra-abdominal pressure was significantly correlated with maximal torque of the hip extensor in each breath hold condition. The current results suggest that a sufficient increase in intra-abdominal pressure has a causal effect to specifically improve muscle strength of the hip extensor. So that's the practical message. So we've got to brace when we're squatting or pressing or hip thrusting, overhead pressing, all of those lifts we need to brace because our hips produce more torque. Okay, another practical study. Moderate load resisted sprints. Stop right there. How many of you have done resisted sprints? Yeah, okay, so this is all about that. Moderate load resisted sprints do not improve subsequent sprint performance in varsity level sprinters. Interesting. I wonder why. Let's take a look. So we conclude that resisted sprints using a sled equivalent loads of 45% of body mass. So that's how much they use, are ineffective. So what they recommend is, in this population of trained athletes, greater loads may be necessary to induce a potentiating effect. So there's that post-activation potentiation again. So they didn't find something significant, but what they did is they recommended future research, maybe with higher loads that would result in a significant effect. Okay, so on post-activation potentiation, self-selected rest interval improves vertical jump post-activation potentiation. How many have been a participant in any of the studies we have going on in this department that have looked at post-activation potentiation? Well, if you haven't been, you will be, because there's more that are coming. Post-activation potentiation. How would you define post-activation potentiation? What does that mean? So you do some type of conditioning activity, could be weightlifting or something heavy, usually. And then you wait a little bit, and then what do? Your nervous system is all charged up because of the heavy lifts. And so you rest enough to get over the fatigue, and then you jump for your sprint. So usually it goes something like this. So we do a dynamic warm-up. And then we do a baseline performance test. And then we have our experimental intervention. So the experimental intervention could be something like a few sets of back squats. And usually it's heavy, so 85% of 1 RM. Okay, then you rest. When you have your rest period. And then you have your post-test. So that's the usual sequence. So maybe some of you would be interested in doing this type of a project. So what we hope would happen is we compare that test with that test, and we're hoping that in this test, let's say this is a vertical jump, and then you do another vertical jump. Okay. So then you're comparing jump height here versus jump height over here. Okay. So if you jump higher over here, what could we conclude? That there's a potentiating effect. So post-activation from the squats produces a higher vertical jump. So this is really important because you want the right stimulus, and you can look in the literature to figure out what works best, usually something really heavy or fast. This is also really important, this part right here. Why? What if you were to go right into a jump 2 seconds after you just did your last repetition on the squat? Muscle fatigue. So this rest period is really important because you're balancing the potentiation effects of the squat and the fatigue effects of the squat. So the rest period has to be long enough that you can get rid of the fatigue, but still have that residual potentiation. That makes sense. So for most studies, the average is about 4 to 6 minutes. Four to 6 minutes between the end of your squat and then your post-test. Not real practical. So what could we do to make it practical? What could we be doing during that rest interval besides just sitting down? Because with the limited amount of time you have to spend in the weight room, you don't want to just be sitting down doing nothing for 4 to 6 minutes. You have what, an hour to get all that work done? You've got to be productive the whole time. You want this potentiated effect. You want to jump higher on that second round, but you've got to also be productive during that rest interval. So what would you do? What could we do? Okay. Maybe. What else?
Do less focus on a different muscle group?
Yes. Yeah, maybe a muscle group that you're not using as much. Okay, an unrelated muscle group that's not going to take away from that jump. Okay, so we can do other things. We could go over to other areas of the body. If it's a jump and a squat, we could do maybe a bench press or a pullover, something that we can still get in some productive training while our jumping muscles are preparing for that second half of the complex. So this post-activation potentiation is also called complex training. So you're complexing two exercises, a squat and a jump, together and trying to get that potentiation effect. So this is a design that you may want to consider. Okay. I think there's actually one thesis student that's doing something similar. Alex Garza is doing something like this semester. So, okay. Another example here. So, last example. So, trunk muscle endurance. What is muscle endurance? How do we define it? It's different from strength.
The amount of reps a person could reduce
Yeah.
without dying.
Yes, perfect. So it's submaximal muscle contractions. It's not maximal. It's not how much we can do one time, but how much we can do repeatedly. Most people with low back pain, it's not a question of strength, it's a question of endurance. Because we use those muscles all day long. So if we have poor endurance in those muscles, we place a lot more stress on discs and ligaments and joint capsules. So what this study found is that healthcare rehabilitation healthcare professionals delivering post-operative rehabilitation after anterior cruciate ligament reconstruction may consider direct assessment of trunk endurance and targeted exercise training to address potential deficits. So what this says is after ACL reconstruction, there might be some deficits here in the core that we can address. If we can address those deficits, we tend to have better alignment all the way down the lower extremity, which reduces the risk of re-injury. So here's what they did as part of this study, these 3 common methods of trunk endurance. Anybody have biomechanics? Yeah, so you did those. Okay. If you have biomechanics now, you'll do these probably around the first part of April. So this is the McGill battery. He's a famous Canadian physiotherapist. So you're just holding these postures with good form as long as you can. So going all the way around the core. So this assesses the anterior, this assesses the posterior, and this assesses the sides. So take a look. This is the control group, so this is the healthy people. And then this is ones that have recently had an ACL reconstruction. So forward flexion in seconds. That's this right there. Extension in seconds. So how long they were able to hold this position. You remember how long you were able to hold that? I think you went along 2 minutes maybe, at least. I remember you had a good result. And then the lateral flexion with the involved limb or uninvolved limb down at the bottom. And so you can see differences here between healthy and ACL all the way down. The p-value over here is important because that tells us significance. So in order to be significant, the p-value has to be less than 0.05. So when the p-value is less than 0.05, that tells us that the difference is significant. So looking down the row, which one do you see is significant? Which value is less than 0.05? Yes. So the difference between extension in seconds for the control and seconds for the ACL group, the p-value was 0.02. So that's less than 0.05. That means this difference was significant. So one of the things that I'm excited to show you in this class is how we get the p-value. So I'm going to show you how to calculate and do t-tests and all kinds of things. You do have to have Microsoft Excel. So you will need to bring a laptop. You do need to have Excel because we will be doing these statistical tests. Okay. All right, so 3 different types of research. Level 1, 2, and 3. As we move in this direction, things become more applied and useful. This is the type of research that we do a lot in this department. Very useful. Things that we can use. Over here, this kind of contributes to the body of knowledge, characteristics of a muscle cell, and so on. Important things to know, but things that we really can't apply. This is kind of in the middle, moderate relevance. Over here is where we get all the good stuff, the stuff that we can take and make things better for clients. So basic research deals with theoretical problems, laboratory setting, tightly controlled, most oftentimes animal models. So we've learned a lot about muscle cells, general characteristics of muscle cells with animal models. The problem is humans are not the same as rats, obviously. And sometimes laboratory settings don't represent the real world. So the practical application is really limited here. Okay, so I tried to come up with an example of each one. So I want you to read the title here, The Effects of Resistance Training Volume on Skeletal Muscle Proteome. Proteome. The proteome is all the proteins that make up a muscle cell. All the proteins involved in a muscle cell. Structure, regulation, muscle contraction, of course. And so these researchers in Brazil, I want you to remember that name, Dr. Tabana. Show you a picture of him in just a minute. Did this research study on rats. How many of you have ever seen rats do resistance training? Okay, well, I want you to read through Dr. Tabana's procedures on how he got rats to do resistance training, and then measured the effects on muscle proteins. Those poor rats. The animal could not complete the ladder climb after 3 consecutive stimuli to the tail. So for loads, they were using a percentage of their max, kind of like what we do for humans. Okay, interesting. Okay, so what they found, it's useful but not applicable. Approximately half the muscle fiber protein content is related to the contractile mechanism. That's interesting to know. So half of the proteins in a muscle cell work directly on contraction. And the high volume of these proteins produce considerable difficulties in detecting and quantifying proteins that were less abundant. So we're talking about proteins, signaling proteins like enzymes, okay, transcription factors, and mitochondrial proteins. Mitochondrial proteins. So that's an interesting take-home message, but can you see? Okay, that's useful to know, but we can't apply it. Okay, all right, so if few years, I've been to Brazil several times to do research. This is me a few years ago. And that's Tabana right there. Dr. Tabana right there. So this particular conference was in Rio de Janeiro. So you can see the obrigado and the Brazilian flag. Obrigado means thank you in Portuguese. But these are some of the best sports scientists in Brazil. So phenomenal. With COVID, I haven't been able to get back down there again, but I really like to. Here's some pictures. That's Dr. Tabana right there. They have lots of outdoor gyms in Brazil. So the conference was right across the street. So I had a chaperone the whole time I was there because I don't speak Portuguese, but I couldn't help. I did a few pull-ups, the gym. This was around November time, but look at the weather. So this is just at the park in the center of the city. There's just people outside all the time. This is their HHP building where they have their research. So this would be the equivalent of our Health and Human Performance Department here. So different culture, but they study the same types of questions we study here. Okay, so applied research level 2. Let's talk about this and then wrap it up for today. Okay, so some relevance. So here's another study that I published with another Brazilian, Marco Machado, and I published this in Medicine and Science in Sports and Exercise. So short recovery augments the magnitude of muscle damage in high responders. Let's talk about that. If two people do the same workout and they have the same training status, is it possible that one person could experience more muscle soreness than the other? Yeah. So how many of you know people that experience a lot of muscle soreness? And then other people do the same workout and experience hardly any soreness. So what we were trying to get at is, why do some people have a lot of muscle soreness and other people have very little?
Because of the type of muscle fibers that they have, where the muscle fibers are used type 1, type 2, type 1X, or type 1.
Yeah, yes. That's exactly. So we were getting into that. So what we thought about is the type of enzymes in muscle cells. So here's our research question. Does muscle soreness vary between individuals of the same training status that do the same workout? So we looked at it by looking at serum creatine kinase. So it's an enzyme inside muscle cells that regulates the phosphagen system. How many, by the show of hands, have heard that phosphagen system? Phosphagen system. It's one reaction. The fastest way to regenerate ATP is the phosphagen system. And the enzyme that regenerates ATP is creatine kinase. So when we work out, we induce a little bit of microtrauma. We get tiny little tears in the sarcolemma. What's the sarcolemma? Yeah, that's the membrane. Plasma membrane of a muscle cell. When we work out, we get tiny tears that allows creatine kinase to leak into the blood. So following a workout for up to 72 hours after, we find that creatine kinase levels are elevated in the blood due to this microtrauma that allows this leakage to occur. And so we thought, well, why don't we start by looking at differences in creatine kinase? And from that, we can estimate maybe the level of soreness, because you would think if someone is really sore after a workout, what are their creatine kinase levels going to be like? It'll be really high. So there's got to be a correlation between muscle soreness and creatine kinase levels. So that's what this experiment was all about. Full body workout, 1 minute versus 3 minutes between sets, pretty simple. 3 sets, 10 RM loads, velocity of reps was controlled, and then we looked at creatine kinase activity. So the independent variable in this case was the rest interval. So the independent variable had 2 conditions. 1 minute versus 3 minutes. So 2 conditions, rest interval is the independent variable. The dependent variable or outcome would be creatine kinase activity. So what we decided to do, HR means high responders. That means very high creatine kinase levels, classified based on creatine kinase activity being in the 90th percentile. So creatine kinase levels following the 1 minute workout at 556.2 units per liter, and 3 minutes a little bit lower than that. To be considered high responding, they had to be above these levels with both workouts. They had to be above these values in their blood following both workouts. So what we found is that 7 out of 32 people were classified as high responders. And it turns out that these were also the people that, with the survey, were experiencing the most muscle soreness. So that's interesting. So a connection between the enzyme in the muscle and the amount of soreness that they're experiencing. So for some reason, these high responding people are very sensitive and able to release more creatine kinase into the bloodstream. It may have something to do with the integrity of the sarcolemma. So there's you dig deep down and you just get tired of thinking about it. But there are definitely differences. What was really interesting is that despite differences in serum creatine kinase, they were both able to accomplish the same number of repetitions. So all of these sets were done to failure, pushed them right to the point where they couldn't do another repetition. So the responses weren't different between groups. High responders, normal responders, they did the same amount of work, but 7 out of 32 of these people, same training status, were classified as high responders. So kind of interesting, getting down at why some people get sore and why some people don't. So this shows the overall response. So the high responders with the 1 minute condition, this is the serum creatine kinase activity before, 24 hours after, 48 hours after, 72 hours after. And so with that particular group, high responders, 1 minute, it's going to peak at about 48 hours. So this is when their muscle soreness was the most intense, right about that 48-hour time point where the creatine kinase was the highest. Okay, so any questions? I've filled your brain with a lot of junk today. Any questions? Okay, so you need to find a topic, and remember, guest speaker on Thursday, and we'll continue with chapter 1. Thank you.
Thank you.